Hi, I'm Curtis Knowles, the Assistant Medical Director for the Medical Control Board, Office of the Medical Director, and today I want to talk to you a little bit about Cyanide Kits. So stay tuned. So within our EMS system, the Cyanide Kits are carried on the Deputy Chief's vehicles since they respond to every fire in the service area. This is normally carried inside of an ammunition box and to keep it protected. And when we open that box, first thing we're going to notice is that we have a copy of the protocol related to administration of the Cyanide Kit. What are the indications for giving this? It's cyanide exposure. We know cyanide is one of the byproducts of fire and smoke production. First thing, let's talk about treatment priorities. First thing is to stay safe yourself, so personal protection. Secondly, patient safety. We want to make sure the patient's removed from any dangerous areas, that where we're going to work on them is safe for both of us. If they're in cardiac arrest, the cardiac arrest resuscitation should take priority. Provide appropriate oxygenation, ventilation for all patients, and then cardiac compressions, IV access, and cardiac medications if needed. And then lastly, if we're going to give the Cyanide Kit, the indications are if the patient was in an enclosed space, so smoke exposure, they have soot or evidence of smoke inhalation, burn, singed hair around the face or mouth, and then altered mental status. We really do want to get to those patients who may have toxic levels of cyanide in their system. Once we open the box, there should be three things. Cardboard box, looks like this, has a glass vial inside of that. Tab on the top, you pull apart to have a ring to hang it and to keep it elevated, and a sterile transfer needle, and then a sterile transfer set. The other thing we're going to add to the kits is a 60 cc syringe and a fill needle, and we'll go over that in just a moment. How do we administer our Cyanide Kit? We need a 250 milliliter bag or larger of normal saline. We're going to use our sterile transfer spike, put it into the normal saline bag, take our glass vial in the cardboard box, insert the other piece of the transfer spike into the glass vial, and then invert our normal saline bag. Now, we need to rotate our bottle so that we can see the line on the bottle where it says fill line. That's where we're going to fill it to. That's 200 milliliters or 200 cc's of normal saline that we're adding to this. That gives us 5 grams of the hydroxycobalamin in 200 cc's of liquid. It's going to turn a bright red, and to help reconstitute it, we need to gently rotate it for 60 seconds. So once we've rotated it for 60 seconds, we want to use the sterile drip set that's included in the kit and spike the bag, clear the air from the line, and it's ready to administer. For adults, the dose is 5 grams. We want to run that 5 grams of medicine, 200 milliliters of liquid, over 15 minutes. To accomplish that, we can set our drip rate at 200 drips per minute, and that'll give us the correct dosing and the correct timing. In pediatric patients, the dosing is a little bit different. We don't want to give the full 5 grams. The correct dosing is 70 milligrams per kilogram. So we have to estimate our body weight and determine how much we need to give. The example of approximately 40 kilogram patient. So if we multiply 40 kilograms times 70, it's roughly 3,000. That equates to 3,000 milligrams or 3 grams of this solution that we've created. To get to that, we're going to give 120 milliliters or 120 cc's of the hydroxycobalamin through an IV over 15 minutes. What we're changing is by adding this syringe and fill needle to the kit, we can now take off whatever we don't need to administer. If we have 200 milliliters of liquid, we want to administer 120 cc's, we're going to pull off 80 milliliters of our liquid and discard that, leaving 120 milliliters in our glass vial. Now we can spike it the same as we did with an adult, clear our line, and it's ready to administer. We'll have to adjust our drip rates to accomplish this. The second piece we are adding to the kits is going to be a reference table on proper dosing based on weight in kilograms with ranges, how much to extract from the bottle to achieve the proper dosing, and a proper drip rate for each weight range. This should help simplify the process of administering the Cyanide Kit to pediatric patients. In conclusion, the Cyanide Kits should be at every fire, and we've had an increased number of fire-related deaths this year, which makes this especially important. It is the primary responsibility of the EMS provider, the paramedic on the fire service, to administer the Cyanide Kit. However, each paramedic, each EMS provider on scene should be fully aware of what's in the kit, how to prepare it, and how to administer it. We've included here a couple links to the Cyanide Kit website. One to look at mechanism of action, the other to look on proper administration of the Cyanide Kit. I hope this helps simplify things, and if you have any questions, please reach out to the Office of the Medical Director office. We'll try to clarify it. Thank you.